Good morning. It is Monday, June 7th, and I'm coming to you from the Personalized Lifestyle Medicine Center by Metagenics in Gig Harbor, Washington. Good to be with you this morning. As you can see from the crawler, this is our gut health program, and this is actually the fourth out of our 5 in this series. And today, as you can see from the title, we're talking about self-care and stress management, and specifically how that relates to the concept of gastrointestinal health. You know, it's been said that we're living in the middle of the biggest nutrition experiment that's ever taken place. And that reference is to the fact that the diet, the American diet, has changed dramatically since the post-World War II period. The affluence, the commercialization, the moving away from eating locally to eating nationally, the fortification of the diet with nutrients and supplements, the addition to the diet of pesticides, herbicides, and other chemicals, preservatives, through the industrialization of agriculture, the depletion of our soil. All of these pieces have changed what we eat. Social changes, the increased number of single-parent families, the increased number of double-employed parents, people working longer, harder hours have all been dramatic changes. And then we had the dramatic change of the COVID epidemic and people working from at home and people not eating out as much. And yet the increased number of people who have done carry out and continue to do carry out. And the lack of, in many food stores for a while, certainly during the early part of COVID, you couldn't get pre-prepared foods, for example. Salad bars have gone away and the such like, so things have changed dramatically, and here we are. And I think one of the big issues that faces us as we try to figure out where exactly we can be in our self-care is being mindful and being aware. And we spoke at length last week about mindful eating and what that actually means. But, that was the actual process of eating. But what we need to also be mindful of is the choices and our strategies around those choices. How have things changed for us? Prior to COVID, were we going someplace and sitting down in a restaurant to eat lunch? After COVID, are we going to a drive-through and, as a consequence, eating in our car, or even eating in our car as we drive back to the office? Are we multitasking? So much of food, as we discussed, is more than the simple nutrient value. It's information, it's food is medicine, and finally it's food is social and connection. And if you've read any of Michael Pollan's books, and he's written books on our food and our food choices, he's written or he produced an Audible monograph, basically like a 2-hour discussion of caffeine and how that's influenced our lifespan. And he has additionally done a book called How to Change Our Minds, looking at psychedelics. In that book, psychedelics, set and setting, is a term that's introduced, and it's kind of like in what circumstance are you going to take in the psychedelic drug? And when you take in that psychedelic drug, you know, the environment in which you do it makes a difference. Similarly, the environment and the way we eat makes a difference. Setting is very important. Our attitudes about our foods are very important. You know, you can imagine that you can be eating the best meal in the world, but if you fail to chew it adequately, you're going to face a challenge in terms of digestion. You know, if you eat something without being aware that you're eating it, you may have enough calories to address the physical hunger component, but you may not have had enough of an experience or enough of enjoyment to address kind of the emotional eating piece or the social connection. You know, if mealtime has been a time for you to connect with your friends and you're no longer going into a restaurant to have lunch with coworkers, and instead you're all individually sitting at your desks, something's been missed, even if you're eating exactly the same food. So part of self-care is recognizing what we have to do to take care and make good choices when it comes to food and our choices around food. And it is something that we clearly can be aware of. So we should be trying to make conscious choices, choices about timing, you know, of our food. You know, if we have issues with esophageal reflux, you know, heartburn, stuff coming up because we've eaten a big meal, you know, in traditional medicine, a lot of that discussion is about stomach acid. In integrative and functional medicine, a lot of that discussion is about motility, like how well are things moving along. Things won't reflux if you have an empty stomach versus they will reflux if your stomach's full and you lay down. So one of the consequences is making sure that you try to address the mechanical features of that. So you wouldn't want to eat, obviously, right before going to bed. You wouldn't want to eat something that would slow your gastrointestinal motility right before going to bed. So eating something, you know, that slows stomach output, like an increased fiber load, for example, may not be the thing that ideally you want to do within an hour or two of bedtime. You know, having our main meal be 3 to 4 hours before bedtime, preferred, and then eating not much after dinner, a good healthy dinner, and instead, you know, hydrating well and going from that point. You know, one of the things also when it comes to food and thinking about choices is what I refer to as functional cheating. And, you know, if we're doing an elimination diet, we really don't want to cheat during the point of time that we're on that diet, because even an occasional cheat a couple times a week is going to be enough to confound the results when we do our read challenges. But once we've, you know, challenged and identified the foods that we need to stay away from, you know, occasionally planning to have those foods in our diet, particularly if they don't trigger acute symptoms but are more related to our chronic symptoms, may be something we allow ourselves to do. Or maybe if we've identified that, you know, we really are addicted to something like a Coca-Cola, we, you know, and it's a pleasure that we want to have, and we've cut it out of our diet, and, you know, substitute something like green tea, mint green tea, which is actually what I'm drinking at the moment and enjoying. But, you may allow yourself to very consciously occasionally, like on a holiday or a vacation or at a picnic or something, to have that choice and to be conscious that you made the choice from a perspective of this fits in with my dietary needs at the moment, and I'm going to be good tomorrow. The fact that I was bad today doesn't excuse me being bad tomorrow. I shouldn't feel guilty about it. One of the things that happens to human beings is when we experience guilt, we want to reduce that. It doesn't feel good to be guilty about our behaviors. And unfortunately, an easy way to stop feeling guilty about behaviors is to stop the behavior. So it becomes one of, okay, I have this rule. I'm not going to drink a Coke today. I'm not going to drink a Coke today. I'm not going to drink a Coke today. And wow, I drank a Coke today and I feel guilty. And a couple of days later, I drank a Coke today and I feel guilty. And then the easiest way to stop is to take away the rule. There's no rule against me having a Coke. I can have a Coke and I don't have to feel guilty. Other strategies for self-care is to think about, is there some component there that's going to make it really, really hard? For example, if you're drinking like 5 to 6 Cokes a day, 16-ounce Cokes a day, well, you're getting a lot of sugar and you're getting a lot of calories, and you may feel run down just because you're not getting the calories, or you may feel run down because you're not getting the caffeine. So the option becomes one of replacing a soft drink with something else that has a little bit of caffeine in it. Maybe having some black coffee, maybe having some lightly sweetened tea instead of the Coca-Cola. And maybe making sure that, if I'm going to think I'm going to be feeling low energy because I don't have all that sugar mid-morning, maybe I'll eat a healthy piece of fruit and have a cup of tea to give myself a little caffeine, and back yourself down instead of going cold turkey from this much caffeine to no caffeine, which is going to drive you right back to having the Coca-Cola. You say, well, I'm going to have, if I was drinking 6 Cokes a day, I'm going to drink 4 teas a day, and then I'm going to take it down to 2 teas a day, and then I'm going to try to drink something perhaps that's like an herbal blend or something where you feel you're getting a health benefit, you're enjoying having either the iced tea or the regular tea, and you go from there. The other parts about being mindful or recognizing the impact that, stress has on our guts. When we're highly stressed, we can experience those feelings in our guts, and they interfere with what we do. They can interfere with our bowel habits, and, it becomes one of, paying attention to that. Like for some of us, and I hear this from many patients, that when they travel or in a less private type setting, that having a bowel movement becomes harder, more difficult, and, maybe that's the time to take a little extra magnesium. Maybe that's the time to create a little bit more of a ritual, get up 5 minutes earlier in the morning and say, even if I haven't had a big urge to go, after I've had my morning tea or after I have my morning coffee and after I've done some of my ablutions in the morning, I'm going to go ahead and sit down for 5 minutes and read something I enjoy and try to go to the bathroom. Taking advantage of the gastrocolic reflex, is a great one, particularly if we're working with someone who's constipated or with a child. So, as in toilet training, taking a child after having eaten and putting them on the toilet is sometimes helpful because that increased gastric stomach motility is going to be associated with increased colonic motility, which could lead to, if you're sitting on the toilet, emptying of your bowels and getting things established. I think that stress reduction, being mindful, having a breathing technique, all of those things play a role in assisting in digestion, assisting in giving us time to rest and assimilate what we eat. Ultimately, at the end of the day, having like a tool that we use to deal with stress or to deal with, are we making our highest choice? Like when it comes to, am I going to stop at this restaurant, or am I going to pick up food from there? Am I going to sit down to a prepared meal at home? How do I meal prep so it makes it easier to meal prep at home? But having something that puts us in a relaxed place, like, a mantra like maybe stop, breathe, reflect, and choose, having established a kind of relaxation practice, a soft belly breathing meditation, perhaps, that allows us to know what it feels like when we're relaxed and compare that to what it feels like when we're not. And when we're not, being able to sense it and stopping for a moment after the recognition, then breathing for a few minutes, sometimes 30 seconds, sometimes a minute, sometimes a couple minutes. It's that classic, count to 10 before you throw a punch type thing. Breathe for, 1 to 2 minutes to reestablish kind of balance, and then reflect about which choice you're going to make, and then actually choose, and then be conscious in that choice, and then live with the consequences of that choice. And frequently we'll make the choices that help us be healthier. Our gut is indeed responsive to stress. We've got to take that into account. Our lives are responsive to stress. We can take that into account. We talked about mindful eating as opposed to just cramming in calories or cramming in foods that bring us short-term pleasure without long-term health. I hope this addresses some of your feelings and questions about this issue. We are going to, Dr. Stone and I, Michael Stone and I, on our Facebook Live this afternoon are going to be talking about some of the lessons we've learned about ourselves and about what constitutes self-care for us during the last year. And we have all of this series available to you if you're interested on YouTube and here on Facebook. So hope you'll join us there. And we will be repeating these series, this one on gut health, one on women's health, and one on cardiovascular health, starting in a couple months. We will be at Feathered Pipe Ranch in July. We'll be at Harmony Hill this coming weekend in June. Look for the podcast at Dandelion Effect at Feathered Pipe if you're interested in learning more. And of course, go to the website either for the PLMC here in Gig Harbor, which is www.gigharbor.plmc.com, or just simply to my website, josephlamb.md.com. I hope you have an awesome Monday. Thanks a lot. Bye-bye.